Meaningful Use Stage 2, Core Set 1, CPOE Medication, Laboratory, and Radiology Orders. The requirements for Core Set 1 actually has three components. It is measuring that the eligible provider enters their medications, their laboratory, and their radiology orders through the structured data of the electronic health record system, specifically the CPOE. Now, CPOE stands for Computerized Provider Order Entry, and within Prognosis, this is your prescription screen, laboratory, and radiology order screens. The objective is for any licensed healthcare professional to enter these orders into the medical record based upon state, local, and professional guidelines. Now, in the context of meaningful use, at the end of the reporting period, during the attestation, there will be three different results reported, and each of these will be a numerical count of orders. The denominator is the total number of all orders created by the doctor during the reporting period. The numerator then is the total number of all of those orders that were actually entered in the structured data. And the numerical result must exceed 60% for prescriptions, and that would include both new and refills. And it must exceed 30% each for lab and radiology orders. Now, Core Set 1 does have an exclusion available. For any eligible provider who writes fewer than 100 orders in each category, you can exempt yourself from that specific segment of Core Set 1. Now, with regards to the first piece, medication orders, there are both internal and external prescriptions. Now, the denominator again encompasses all prescriptions ordered inside the reporting period. The numerator, however, is only going to count internal prescriptions. And by that, I mean prescriptions that you actually order through the electronic health record. So as we see here, for internal prescriptions, there are three different ways in Prognosis. You can do it directly through the Encounter Table of Content prescription option. You can do it from the CPOE tab, either prescription or refill, or during med reviews on the face sheet current medications, there is a plus RX column. The external prescriptions is a requirement of O&C certification, and those are handled directly through the face sheet under the current medication transition of care. So we're going to look at all of those examples now. I'm going to go ahead and open up my patient, Derek Abdomen, who's already been arrived here for the day. And first of all, for the prescription, we're just going to choose prescription here along our table of content on the left. You, of course, want to follow all of the protocols for a prescription writing in your office, whether you're going to be choosing preferred pharmacies, using the pharmacy lookup, and so on. We're just going to go ahead and give him a prescription for ibuprofen. Now, I am logged in as Dr. Koothrappali, so I am getting a save and approve automatically. For those of you who are entering the prescriptions into CPOE, your status must be at least approved or ordered. If you do not have approval permissions, this message is only going to say save, and that would not be counted in your numerator because the order must be actually completed inside the EMR. Now, for Core Set 1, there is no requirement for how you get the prescription to the pharmacy. So whether you choose at this point to print it, to fax it, or to e-prescribe it is irrelevant in the context of Core Set 1. As long as the order or the medication itself, the prescription, the details, the frequency, the strength, and so on, are stored in the electronic record for more than 60% of your prescriptions, you're going to be compliant. Now that is for an internal prescription. Now if we go to Derek's face sheet and open his current medication, another way of an internal prescription is during your med review of a patient's existing meds is to click the plus RX column, which would also then transfer over to the prescription screen. But certification requires that external prescriptions also count in the denominator. They will not, however, count in your numerator. This would be an example when you are writing a prescription and Prognosis is not immediately available, but you need to get the prescription called in. Maybe you're on vacation, out of the office, after hours, whatever your scenario. So we're just going to go ahead and click the add drug in this case. We're back in the office now playing catch up. you want to go ahead and add in your prescription. But since you are not doing it directly through the CPOE in real time, you're going to enter it as an external RX. So under your current medication, you're going to document it as if it was an existing drug, but for your source, you're going to choose external RX. And that will tell the meaningful use reporting to count it in the denominator, but not in the numerator. Dealing with lab and radiology are going to be very similar to one another. The user interface and prognosis is the same. Just the details underneath are different as to whether you're choosing a lab or radiology vendor, a lab or radiology test. You have both internal and external orders, just as we spoke about under prescriptions. The internal orders can be done directly from your table of content, choosing the applicable order option, or in the case of pre-op, you can do lab and radiology from your schedule. You've also got the lab result, radiology result options, which allows you to create external orders. So again, using Derek, since we already have him open, we're just going to go ahead and choose lab order. And again, radiology order mirrors it, so we're just going to do the one example here in our video. We're going to choose our lab. We'll say Quest and go ahead and order a test. Now, again, with regards to completing these orders, you would, of course, follow your local processes. For training's sake, I'm not going in and adding diagnoses or adding comments or any of that. So just keep that in mind. Now, again, we're dealing with our status. Anything under CPOE has 3 statuses. It begins in an entered status until somebody with approval rights saves it and therefore approves it. And then whether you are printing, faxing, or e-sending it, that will send the status to ordered. In the context of meaningful use core set 1, again, it doesn't matter how you transmit the order to the vendor. The measure is only looking that you've entered the order criteria into the electronic health record. Now that's for your internal in conjunction with a live encounter. If we quickly go to our schedule screen and select an appointment, whether they've been arrived yet or not, down here in our patient info panel, we have the L and the R icons. And that allows you to create a lab or radiology outside of an actual encounter. But that would still be an internal order. But the last scenario we want to look at is your external lab or radiology. So back on the encounter, this time we're going to choose lab result. The result option on your encounter allows you to enter a quote-unquote phantom order because you're actually wanting to enter the results that you're reviewing with your patient. This is also where you're going to directly enter an outside or an external prescription. So we're going to just go ahead and click our Add New. The distinction here is for your ordering doc. Instead of the default external doc, which you typically use when you are simply creating a phantom order for the sake of documenting results that you've reviewed, when you're actually creating an order that you did outside of the structured data, you're going to choose yourself. So then when an external order is saved in the database for an internal doctor, it will count in the denominator of meaningful use, but it will not count in your numerator. Now again, for time's sake here in the training video, I'm not going to go through and enter diagnoses and all that, but I am going to go ahead and save my radiology order. So as regards our status, since this is an external order, it follows a different workflow. Hence, the status will show as results received, but notice the screen message says incomplete, not approved. Now, if you choose to go ahead and enter a result at the same time that you are entering the external order, you will get the same green message, save and approve, as we saw with our internal orders, but the status in that case will show as complete. Either way, external orders are only counted in the denominator for core set 1, and they are not counted in the numerator.